Hey, this is Ali Sue. Welcome to Pharmacy Entrepreneur TV. If you are a past, present, and future pharmacist, and you want to create a business and life you love, this is the show for you. Today, our guest is Dr. Stacie. Dr. Stacie is a pharmacist, associate professor of clinical pharmacy, certified aromatherapist, board-certified pediatric pharmacy specialist, as well as a board-certified patient advocate. Dr. Stacie always had a desire to inspire, educate, and help everyone around her. It is no surprise that after graduating pharmacy school, she started her career in academia. Being an associate professor allowed Stacie to combine her knowledge as a pediatric clinical pharmacist with her passions for aromatherapy and herbalism. Then, when her world was turned upside down from cancer, she made it her life's mission to support patients and became a patient advocate. Dr. Stacie enables people to feel independent and strong enough to make their own health choices when faced with internal struggles from a new diagnosis and external difficulties from the complex healthcare system. Let's welcome Dr. Stacie.
Hi, Stacie. Thank you so much for joining us today. We're so excited. Now, we know that you're an associate professor of clinical pharmacy. You also do herbalism, aromatherapy. I just want to know, how long have you been in the pharmacy world? And
Hi. I am so happy to be here, Ellie. Thank you for having me. So how long have I been in the pharmacy world? It's almost been 11 years. And I graduated from pharmacy school in 2009, and I did a clinical residency in the United States right after. And then I ended up right into doing academia right after that. So I've been practicing in academia, and associated with that position, I do pediatric clinical pharmacy. So I spend half my time in teaching and half my time teaching students in the clinical setting in a pediatrician's office doing that. So that is a quick summary of what I've been doing and how long I've been practicing clinical pharmacy.
Yeah, wow. So what's the one thing that you've gained or learned during that pharmacy career or being an associate lecturer teaching pharmacy students?
The one big thing I learned is there's just so much opportunity out there in pharmacy. And I try and instill that in our pharmacy students too, because I felt like when I went through pharmacy school, I didn't realize how expansive pharmacy could be. And I thought that I was going to work in a community pharmacy my whole life. That's where I started when I was an intern in a pharmacy when I got into pharmacy school. And it wasn't until my third year of pharmacy school that I realized you could actually become a pediatric pharmacist. I was just shocked by that. So then I try and instill that in students, and then I see them too. They even teach me all these different places you can go with pharmacy, industry pharmacy, research pharmacy, working for the FDA. And so I just see them all going into different areas, and it just surprises me all the time just how much pharmacy is. It's a niche in itself, but there's so much opportunity there.
Wow, wonderful. So I know that you've started your entrepreneur journey. So what struggles really stood out to you during the process of discovering your purpose?
So when I started my entrepreneurial journey, it was actually a couple years ago, and it was just a thought in my head, but I had breast cancer, and I was laying in bed one day and just was like, what am I going to do with my life? I love pharmacy. I love my job. But at the same time, I just felt like there was something more in me that I always wanted to do. And so my obviously biggest first struggle was cancer. But then from there, once I realized how complex the healthcare system was going through cancer, and that's where I I realized there was so much struggle out there with that in terms of how to make doctor's appointments, something simple that you think is simple. A lot of people don't know how to do, how to make second opinions, how to get test results, how to talk to the insurance, how to talk to the doctor for that matter. So I didn't find it easy, but I could see how hard it is for other people. It wasn't easy for me per se, but it wasn't super hard for me either. And I'm like, if I had no medical knowledge, I don't know how I would have gotten through cancer on top of the emotional side of it, just like learning in the healthcare and advocating for myself and making my own health choices. So I think my biggest struggle on the path was just figuring out what I wanted to do and how I wanted to, once I realized that my purpose was to help other people feel empowered about making their own healthcare decisions, how to put that all together and put it into a business basically, or an entrepreneurial endeavor.
Yeah, wow. It is, definitely a struggle when you're facing physical illness. And it could happen to any of us, especially when we work so hard, not looking after our own health.
Yeah. And that was part of it too, just to add a little bit onto that, is what really shook me was I ate relatively healthy. I ate organic. I worked out, probably not as much as I should, but like most people look at me as like a healthy individual, and I have no family history of it because I get that question every time. My oncologist said I just had bad luck. So I also do think, though, it was somewhat stress related, right? I'm that type A person that has to do everything perfect. So it's also, I guess, adding on to my struggles. Another struggle down this path was to just let it happen and just see what happens and not try and be perfect along the way.
Yeah, great advice. So what have you achieved from stepping into your why and being brave enough to accomplish your dreams?
I feel like I've just achieved, on the baseline, it sounds really probably corny, but inner peace. I just feel like I am on this path. I have a purpose, and I just feel like inside of me, like this is the right thing. And granted, it's not peaceful all the time. I don't live in this perfect rainbow, rose-colored glasses, peaceful world all the time over it. But I just feel like I know this is what I'm supposed to do. So I think that's probably the biggest achievement, is just going after that. I just feel like I can go after this. The other thing I achieved along this way, and I think this is my also good thing for pharmacists, is we tend to be the perfectionist types. And one thing, and it stresses you out, right? You're just super stressed all the time about being perfect. So on the entrepreneurial path, I've also kind of realized that I can lower my stress. It doesn't have to be perfect. I can have some fun with it. I don't have to, you can be professional and fun at the same time.
Yeah.
And I feel like sometimes we like hide that as pharmacists, right? So we just try and lock it all in and just be very professional. So I kind of also feel like I achieved letting that part of me out that I always used to hide, especially being a faculty member in a school of pharmacy and then a pharmacist and all that. I like locked all that fun inside of me, and I feel like this is another way I can let it out.
Yeah, great. Yeah, I love it. Just be ourselves. And we're definitely having lots of fun filming this Pharmacy Entrepreneur TV. So how do you integrate all your wonderful clinical pharmacy, herbalism, aromatherapy, and the patient advocate? And what is the patient advocate to start with?
All right, we'll start with what is the patient advocate, because it is, I don't want to say it's a new-ish term. Advocacy's been around forever, but it is a newer concept, I guess, in terms of what is patient advocacy. So really the premise behind it is advocating for the patient. Either we advocate for the patient, or what I want to do is teach the patient how to advocate for themselves. So when they're going into a healthcare visit, that they feel like they can ask questions and they can advocate for their own choice and feel confident that if they're not comfortable with their provider, they don't have to stay with their provider. Or if they have questions about medications, they can definitely ask that. So it's really just, it's a whole spectrum. It can be insurance advocacy, anything that kind of fits in that Western medicine field or not Western medicine field. So maybe they want to look at alternative options that they're comfortable and confident in doing that. So kind of patient advocacy is hopefully what it sounds like in the terms put together. It's really advocating for the patient. Either the patient advocates for themselves, somebody else advocates for themselves.
Yeah, it makes sense. So how do you then integrate all that together?
So that was one of my struggles that I didn't probably mention earlier is so I was a clinical pharmacist and forever pediatric pharmacy. Like I said, I love it. And I just always love everything I do, but we pivot and find new interests. So after doing that for a while, I started to get interested in aromatherapy. So I studied to become a certified aromatherapist, and that was started about like 3 years ago. And I'm like, wow, this is such another avenue and can really help potential patients. And herbalism, I got interested into along the way as I was studying that. And we have a great herbal community here where I live. And my struggle was, how do I put those two together? Because that's what I was really doing first before patient advocacy came in. But this was all before I was even diagnosed with cancer. So here I am on this Western medicine side, practicing pharmacy and clinical pharmacy and meds. And then on the other side of me, I'm doing aromatherapy and herbals and teas and making my own stuff at home. And I'm like, how do I put these together? So I struggled with this for a while. And then that light bulb, like I said, really went off when I was going through cancer, and I really wanted to help other patients, that I can kind of put them together with that patient advocacy umbrella. It's kind of how I'm in my mind putting them together, is that I can really educate the patients on both sides of the coin, and that empowering yourself isn't just empowering yourself in the healthcare system, but trying what works for you. Maybe aromatherapy works to help reduce stress for you. Maybe it doesn't, or maybe herbs do, or maybe other practices for sure that are out there. So I kind of feel like it's finally starting to come together with that patient advocacy piece. And I do feel like a lot more people and patients these days are looking for something like that. They believe medicine works, but they also, there's some distrust that's going on in the healthcare system, unfortunately, and they want to know what they can do also. So I kind of feel like it's coming together. I have both things going on, and hopefully can educate patients on how to talk to their doctor about herbalism and how to find those answers to those questions.
Wow. So interesting. Yeah. Wow. Very unique. And then you're a combination of all, and then you can, and it's great as a clinical pharmacist. From a clinical pharmacist point of view, then you have all the evidence-based knowledge and know where to look up things, and how to find evidence-based research, and then you can communicate that to both patients as well as to doctors. And
and that's definitely the hope. We want to make sure that people are using everything appropriately too. Like aromatherapy, there is a misconception out there that it's perfect for everybody, and it's not. There are side effects with it. There are misuse of it, and hopefully I can help inform.
Amazing. So last question: as a associate professor of clinical pharmacy, what's your advice for our aspiring pharmacists?
I think, as I kind of mentioned earlier, really my biggest advice is to just go out there and realize there's so much opportunity. And even, yes, there's so much within a pharmacy degrees that we talked about earlier, like you can work for the FDA and industry, and there's a lot of established pharmacy careers, but I don't even think there's all the careers out there are developed yet. So take that passion of yours. If you want to start a podcast or a TV show like Ellie's doing, do it, and do it while in pharmacy school, and just go with it. I feel like, we're so a little bit stuck in the pharmacy school, clinical pharmacy, and what are our options? And I don't know how environments are in every country, but it's a little bit harder to find some jobs in the United States, depending on what you want to do. But our PharmD degree is amazing. Like you can do so much more with it than is even out there job wise that you would even be looking for. So talk to entrepreneurs, talk to other pharmacy entrepreneurs if that suits you. Yeah. If it doesn't suit you, then don't do it. That's fine. Yeah. Not everybody has to be a pharmacy entrepreneur. We need community pharmacists. We need clinical pharmacists. We need all pharmacists. But don't feel like you can't do that, I guess is kind of my biggest advice.
Yeah, wonderful. Well, thank you so much, Stacie, for coming on the show and sharing your wisdom and your experience and knowledge. Thank you so much.
Thank you.
So,
This was so much fun. I'm so glad I
yeah,
was able to have, and it was great talking with you.
yeah. Thank you.